Welcome to the Informed Pregnancy and Parenting Podcast. I'm your host, pregnancy-focused chiropractor, Dr. Elliot Berlin. Today we're covering a serious but often misunderstood condition, preeclampsia, and specifically postpartum preeclampsia. I'm excited to bring you both personal and medical insights to help you recognize symptoms, understand treatment options, and know what it's like to navigate this experience. We're joined today by two wonderful guests. First, we have Jamie Barstein, a child and adolescent psychologist, but more importantly for this episode, a mom and a patient who faced postpartum preeclampsia after the birth of her first child. She's here to share her story of unexpected symptoms and the adjustments she made to prepare for her second postpartum period. Also joining us, Dr. Nathan Fox, a board-certified obstetrician gynecologist specializing in maternal fetal medicine. Try saying that 5 times quickly. Dr. Fox completed his medical degree and residency at Mount Sinai, followed by a fellowship at Weill Cornell Medical College. He's now a clinical professor at Mount Sinai and provides high-risk pregnancy care at Maternal Fetal Medicine Associates of New York. He's been a previous guest on a number of episodes of this podcast, and you can find his awesome podcast, the Healthful Woman Podcast, at healthfulwoman.com and every place you listen to podcasts. And also, we have a bunch of your podcasts on Informed Pregnancy Plus, streaming right into your living room or wherever you listen and watch. Dr. Fox also co-authored the relatively new book, The Unexpected, with Emily Oster, an economist and author, which explores common pregnancy complications and emphasizes the importance of data-driven support for maternal health care. Dr. Fox, welcome to the podcast.
Thank you for that terrific eulogy.
Yeah, I'll be ready. They can call on me. All right. It's a really important topic, preeclampsia in general, and also postpartum preeclampsia, which for reasons I'm not quite sure I'm seeing or hearing a lot more about of recent. We can potentially jump into whether that's actually more cases happening or people just being more aware of it. But Jamie, let's start with you because you experienced it and it came out of left field for you. What was your experience with your first pregnancy and birth?
Yeah, thank you. And also, Dr. Fox, super cool your book. I can't wait to read it.
But you'll be the third. Awesome.
Yeah. Emily Oster.
No, I'm kidding. Emily is a rock star. So
yeah, she's my god in terms of as a psychologist too for friends. I'm like, just listen to what she says and it'll ease your anxiety. So
all right. Well, if she's your god, I'm like one of her angels.
Okay.
All right.
I love it.
With the little red horns?
Probably.
Yeah, so my daughter, who's now 3.5, had a fairly smooth pregnancy with her. I mean, all things considered, was nauseous and a few different things, but for the most part, fairly smooth, nothing significant. And then my delivery, so I went into labor, my water broke and ended up unsuccessful vaginal delivery and had a C-section. So, I'm exhausted. I'd had surgery. I'd labored for 30 hours and came home from the hospital a few days later and was like, I just don't feel right. Actually, it was a day later that I came home from the hospital. This is like day 4 of having my daughter. And, I don't think you're supposed to really feel right after you've had a C-section and had a baby. But my sister-in-law, who's a doctor, I'd reached out to her and I said, I'm having a hard time catching my breath. And so she said, she asked me, do you have a headache? I said, yeah, I have a headache. I mean, I've had a headache for really 9 months of pregnancy before I was seeing Dr. Berlin to help me with my headaches. And
I'm grateful for your headaches then.
Yeah. And my feet were swollen, which they had been when I left the hospital. But my mom was here helping and she was really worried about how swollen my feet were. So my sister-in-law said, you know what, you should check your blood pressure. The only reason why I even had a blood pressure cuff is because it was COVID. And so I had, a blood pressure monitor. So I had some stuff at home because not all of my appointments were in person. But otherwise, I wasn't told by anybody to check my blood pressure. And I remember it so vividly. Something was plugged in wrong and I couldn't get to work. And I remember texting my sister-in-law saying, do I really need to check my blood pressure? Can I just go to bed? And she's like, you should check your blood pressure. And I checked it and it was 190 over 110. And she's like, call your doctor, but you need to go back to, the hospital. At which point I called my doctor and the doctor on call said to me, why are you checking your blood pressure? Which leads to me hysterically crying, I don't know, I'm checking my blood pressure because I was told to check my blood pressure. And I remember the doctor on call says to me, are you anxious? I'm like, of course I'm anxious. I
am now.
Yeah, I was told, and so I remember the doctor on call told me to take some deep breaths. And then, took some deep breaths, took my blood pressure again. It was similar. I think it's maybe 189 over, 110 or something. I don't know. And said the same thing, go back to the hospital now. And I mean, I don't even think I knew what postpartum preeclampsia was. I'd heard of preeclampsia, but I don't think I really understood that it's something that could affect you in the postpartum period. I mean, I know they're checking your blood pressure at the hospital, but it was really quite shocking. Get there, find out I had, and Dr. Fox, you'll make sure I'm saying this right, but elevated platelets and liver enzymes and kidney enzymes that were atypical.
Probably low platelets.
Low platelets, opposite.
Yeah. Oh, they could have been elevated, but
something with my platelets.
Probably low and elevated liver enzymes. Did they give you the diagnosis of HELP?
They didn't give me the diagnosis of HELP, and maybe you can talk about what that is, but I did have kidney, liver, and platelet abnormalities. And then the biggest thing that I had actually at that point was I also had excessive fluid in my lungs.
Oh my God.
So they had started me on magnesium, but it was causing more fluid in my lungs or a complication. And so they stopped the magnesium to then get the fluid out of my lungs and then restarted me on the magnesium.
I feel like if this is a jigsaw puzzle, you put together some of the middle pieces. And we need to put the frame around it to get a little perspective. But before we go there with Dr. Fox, with all the information, a few questions for you, Jamie. First of all, that's a pretty high blood pressure for anybody. But what's your normal blood pressure? Do you know how it typically runs?
Yeah, I mean, it's pretty normal. Maybe like 110 over 70. That's normal, right?
Yeah. So this would be much higher. Also, I think those home blood pressure cuffs are notoriously not that accurate, but when it's that high, especially twice, then even if it was just a green light, yellow light, red light, you got a red light twice. And then the other thing is, was your blood pressure normal in the hospital before you left? I assume it was if they discharged you. Okay.
Normal blood pressure in the hospital before I left. Normal blood pressure at every appointment or anytime I took my blood pressure during pregnancy. Yeah, there was no concerns about my blood pressure. I mean, I was discharged with, no concerns. I mean, to be honest, I was pretty out of it, but I don't vividly recall. So, I'm sure there's something in the packet that they give you, but nothing that was like, hey, make sure you're checking your blood pressure. Here are symptoms to look out for. Those were things that were told to me in my most recent postpartum. And they said, because you're at risk for postpartum preeclampsia, here's what to look out for. But I didn't get any of that in the initial discharge.
Got it. All right, Doc, let's talk about preeclampsia first. And also the sort of, I think a lot of people misunderstand the pre is not in reference to labor. Sometimes people think like preeclampsia means eclampsia before you go into labor, but it's a state of not yet eclampsia. Clear this all up for us.
Yeah, so first of all, Jamie, that's pretty scary. You were pretty sick. I know you're aware of this, but just for the listeners, that's a pretty impressive, not in a good way, presentation for what you had, because I'm glad you're okay and you were okay. So preeclampsia, essentially, it's a condition that's related to pregnancy, meaning the only people who get preeclampsia are either pregnant women or people who were just pregnant. So you can get it postpartum like you did. It's related to the placenta, and why people get preeclampsia and why others don't, we don't exactly know. We know a lot about what happens when one gets preeclampsia, and we know that there are risk factors for preeclampsia, but exactly why it happens in someone and not someone else is not clearly defined. But when it happens, typically the most common manifestations are your blood pressure goes up, which most people don't have symptoms when that happens. Occasionally people will get headaches when that happens, but usually they have no symptoms. So that's reason number one why it's challenging. Number two, they get protein in their urine, which has no symptoms associated. You would not know if you were peeing out protein in your urine. So that's the second reason. Consequently, that's why at every prenatal visit, the two things we have you do is get your blood pressure checked and pee in a cup. It's essentially because we're looking for preeclampsia, because you wouldn't know at home. And then on top of those things, there could be a whole myriad of complications related to your platelets could be low, your liver enzymes could be high. It can affect your brain and cause severe headaches and cause potentially seizures. That's where the word eclampsia comes from, when you get a seizure. And preeclampsia is a state before that. It can affect how the baby grows and develops if you're still pregnant. It can cause you to get fluid in your lungs like you had. It can cause a whole host of things. It causes typically a lot of swelling. However, probably 50% of pregnant women have a ton of swelling anyways. And so that's why it's one of these things that's kind of silent, because you don't know your blood pressure's high. You don't know you have protein in your urine. Most people are swollen. And unless you have headaches or shortness of breath, you usually aren't going to have symptoms related to those blood disorders. Now, the chance of getting preeclampsia at baseline is ballpark 5%. So 1 in 20 women will get it. People with risk factors, like if you have twins or if you are, let's say, much older, or sometimes if you had IVF or if you're coming to pregnancy a little bit overweight, it can be higher, but higher means like 10%. The only people who have a very high chance of it typically are people who come into pregnancy with high blood pressure as a condition, people with a history of preeclampsia, and people who are significantly older, like people in, let's say, their late 40s or 50s, have a much higher chance. But the bulk of them happen or present during pregnancy or in the hospital after you deliver. So most people, if they're going to get it, like if they're in that 5, 10, whatever percent, will have signs and symptoms while they're pregnant or in the first 24 hours, let's say, after delivery, so it'd be picked up in the hospital. It's a little bit unusual to have what you had, which is you're perfectly fine and you're in the hospital for 3 days because you had a C-section, and then go home and have it. Again, it happens. It is absolutely possible, but it's unusual. And for that reason, it's not currently recommended that everybody go home and check their blood pressure to look for preeclampsia, although it seems to make sense. It's not currently recommended, I think, because the chance of it happening is very low. And probably a lot of people will get false scares related to abnormal machines, or they won't have access, and then they're going to have to go somewhere else to get their blood pressure. And I think, again, I'm guessing here, but my guess of why it's not routinely recommended for everyone is sort of the logistics of it might be complicated. But certainly for people at high risk, we do tell them to take their blood, or at least I do tell them to take their blood pressure at home. I actually tell them about once a day for a week or two after they go home. I don't know if I would have told you that because, again, I haven't done a full evaluation of you, but you don't appear to be high risk from your story, at least before your first pregnancy. But it is a routine thing when you leave the hospital to tell people, hey, if you have things like headaches or shortness of breath or extreme swelling or this or that, to give us a call. And it's possible they told you and you don't remember, because who the hell remembers what they tell you and leave the hospital? Or it's possible they didn't tell you. I don't know. But I would imagine most hospitals do give people some sort of education about that, but it's hard to remember those things.
Do we know what's behind the changes that are taking place? What the mechanism is that makes it happen?
It's essentially the body's reaction to hormones from the placenta. It's sort of parallel to gestational diabetes, where the hormones of the placenta cause you to sort of your sugar metabolism to get slowed down. But here, instead of your sugar metabolism, it's your blood vessels clamping down, causing high blood pressure. And then when they clamp down in various organs, they can cause problems there. There are a lot of molecular pathways that have been worked out relating to various what we call angiogenic factors that come from the placenta. Those are factors that sort of promote blood vessel development in the uterus. But again, why it happens in one person and not someone else, some of it is luck. Some of it is probably factors we have not elucidated. And some of it is probably predispositions like genetic or health reasons to have that reaction to it.
Okay, I want to take a quick break. When we come back, we'll find out what happened, Jamie, with your experience after you were diagnosed, and also more about treatment in general. Don't go anywhere. We'll be right back. Welcome back. We're talking about preeclampsia and postpartum preeclampsia with Jamie Barstein and Dr. Nathan Fox. Okay, so Jamie, what happened after you got to the hospital? You got in and your blood pressure was high, you found the enzymes, your headache was pounding, your feet were swollen, and they put you on magnesium, but then fluid in the lungs.
Yeah. So the fluid had to come out of my lungs, and my memory's a little hazy. So I think then they restarted me on the magnesium. Would that make sense, Dr. Fox, that they restarted the magnesium, or no?
They would probably give you medicine to get the fluid out of your lungs. They probably gave you a medicine to lower your blood pressure.
Yeah.
And they may or may not have restarted the magnesium based on how you responded to those things.
Sure.
You know, magnesium does not cure or even treat preeclampsia.
It just prevents the seizures, right?
It prevents eclampsia seizures. And the chance of getting a seizure diminishes the farther you get away from delivery. So sometimes, even if we admit people to the hospital for preeclampsia after delivery, sometimes we give them magnesium, sometimes we don't. And how long we give it if you're on it is also
Yeah.
somewhat arbitrary. So it could have gone either way. I don't know what they did with your magnesium, but it is concerning if you have fluid in your lungs because one of the side effects of magnesium is respiratory depression. You sort of don't breathe as heavy and you lose your urge to breathe. So people with fluid in their lungs, we get concerned that we're going to harm them if we give them magnesium. So it's a delicate balance.
Right.
Have
And I
you,
remember that. And I remember it being serious. I mean, I'm sure this maybe is every doctor's worst nightmare. 'Cause my cousin who works in emergency medicine said it's his worst nightmare. Well, I kept looking at everyone saying, am I going to die? Am I going to die? And everyone's response was, it's good you're here. Right?
Oh my
Like,
God, the response should be no, you're not going
right.
to die.
Well,
How about
maybe it
that?
was no, but as an medically anxious person already, this definitely fed my medical anxiety, which is like, you're not going to die. And also, it's good you're here. We need
Yeah.
to treat everything that's happening for you.
Preeclampsia does kill people.
Yeah.
Preeclampsia can be fatal, and that's why it's such a serious condition. And one of the components of the alarming high rate of maternal mortality in this country is related to preeclampsia. However, it is quite unusual to die from preeclampsia while under medical care that is good, that's paying
Yeah.
attention to you and caring for you. Again, there's no guarantees in life for anything, but it is very, very unusual to die from preeclampsia if you are under the watch of people who are watching you.
And I
Two
should say, I
questions
mean,
for
I
you.
was at a fantastic hospital under wonderful care. Like, I'm a very
Yeah.
privileged person, and it was really, this is a top-notch place. So, yeah.
I have a couple of questions here.
Sure.
Dr. Fox, first of all, people take magnesium during pregnancy to help them feel calm and to sleep better and for the muscle cramps to go away. Wickedly different than what you're talking about.
Yeah, so the magnesium people take in pregnancy for that, or even for constipation or for headaches, is oral, and it's in the order of hundreds of milligrams you take by pill. But when we give magnesium for preeclampsia, it's given either typically intravenously, sometimes intramuscularly, meaning a one-time injection like a shot, but most of the places in the US will give it intravenously. And you're typically getting 2 grams an hour. So 2,000 milligrams every hour by drip. So it's a much higher dose. And it does not typically make people feel calm, relaxed, and
No.
delightful. It usually makes people feel like it ranges from some people who are very lucky, don't have symptoms, but it ranges to that to people saying they feel like they have the flu, they feel like their head is on fire, they feel like their body's
My
on fire.
chest was on
Yeah,
fire.
yeah. So
Yeah.
that's a very common symptom. People typically describe magnesium as exceedingly unpleasant in one way or another. Again, not everyone. Some people are fortunate that they don't feel so much of that, but it's not the same thing as the pills people take. And giving someone the pills would not help for
That's
preeclampsia.
almost always how people describe it to me.
Yeah.
That miserable. They hate it. And also,
Miserable.
seemingly, they're in a part of almost like an extra care part of the unit.
Yeah, like an intensive care unit almost. The best description I've heard is flu in a bag.
Ooh.
Yeah, it's pretty miserable.
So sharks.
Yeah. And
Okay.
I remember feeling somewhat like kind of loopy too.
Yep.
I also hadn't slept for days, all the stuff, but yes, very loopy, very out of it. And then there's the emotional piece, right? Of like, I just had this brand new baby.
Yes.
Come with me to
That's
the
what I'm
hospital.
wondering. Your baby's at home and you're at the hospital just a few days after giving birth.
Oh, they didn't let the baby come with you?
The baby could have come with me. It was also COVID times too. So I think my husband came to the hospital with me, and my parents who were home visiting, they stayed with the baby. The baby came to visit me during the day. But it was a lot. I couldn't really take care of her. And then my husband was taking care of me.
Yeah.
That was really, really emotional for me. And I kept saying like, wow, I'm so grateful that this is me who's sick and not my baby. I can't imagine the stories, when the baby is sick or when both are sick, but it really was just a really emotional experience to be separated. And, it was hard. It was really hard.
And then were you pumping?
Yeah. So then I started pumping. Breastfeeding was new. And so there was this kind of experience of like, I want to make this work, but then she wasn't latching. And how much of this is also like, have we given each other time to latch? The one nice thing was there's a lactation consultant at the hospital. So when the baby was with me, it's funny calling her the baby. She's 3.5 now, but it's like she's separate, different person than when she was with me, the lactation consultant was helping. But yeah, I started pumping earlier than I wanted to start pumping, but I did. And then I remember the video of my mom saying, like, look, Emmy's having her first breast milk and kind of syringing the breast milk into her while I was at the hospital and she would come with her. Yeah. Yeah.
This is postpartum, but Doc, you said that essentially preeclampsias could be quite dangerous, and it generally happens during the end of pregnancy. So, what are the treatments for it while you're still pregnant?
So, the only cure for preeclampsia is to deliver the placenta, which of course means to deliver the baby as well. And so, there's always a decision that has to be made when someone has preeclampsia or a form of preeclampsia with mild, moderate, severe, whatever it is, what to do. And if you're towards the end of pregnancy, if you're near the due date, it's pretty clear the best thing to do is deliver. If you're preterm, premature, then a decision has to be made. Is it better to deliver and cure the preeclampsia and have a premature baby? Or is it better to wait, sort of sweat it out a little bit with the preeclampsia and let the baby mature a little bit longer? And that's obviously a very complex decision based on how early are we talking and how severe are we talking. So those are the variables. But generally, to treat, you have to deliver. There are things we do in addition to that, like there's medications we give to lower someone's blood pressure, which just temporizes things and prevents maybe a stroke from happening. Again, the magnesium doesn't treat the preeclampsia, it just helps prevent seizures. And so it's really delivery. But the ironic thing is that you, Jamie, developed your preeclampsia after the placenta was already delivered. And so, like, we can't deliver the placenta again, right? It's already out. And so, for whatever reason, in some people, those changes linger. Like, the most typical presentation of preeclampsia is someone either towards the end of pregnancy or in delivery, their blood pressure starts to go up. They have preeclampsia. We deliver the baby, deliver the placenta, and then at some point thereafter, they get better. Sometimes it's 2 hours, sometimes it's 2 days, sometimes it's 2 weeks, and rarely it's 2 months. But at some point, they just get better and they continue to improve. But for whatever reason, there's a few people who, after the placenta is out, that's the first time they ever manifest with the condition, and they have like a delayed response to it. And we don't know why that is, but if you just wait, it will eventually turn the corner and get better. So I'm sure in the hospital, what they were doing is watching you, making sure your blood pressure is okay and you're okay and nothing bad is happening to you while they watch you, and just give it time, and eventually it will just self-correct, turn the corner, and you'll get better. I assume at some point you went home. Did you have to go home on blood pressure medicine or no? How long were you on it? A couple weeks?
Couple weeks, yeah. I
Yeah.
think at my 6-week appointment, I was really pretty much off.
Yeah. Yeah.
I was really anxious to go off of it. I mean, I'll be honest, even for months, maybe a year, 2 years postpartum, if I ever felt like shortness of breath, which
Yeah.
anxiety, but
Yeah.
but if I ever
Yeah.
felt that, I've checked my blood pressure. Like my
Yeah.
blood pressure must be high again, just that feeling
Yeah.
of back
Yeah.
to. And
It's
it's a
yeah.
condition that I had, and I
Yeah.
no longer had it, but I think just that trigger of like, is this coming back to me again?
It's not unreasonable. There are a certain small percentage of people who develop preeclampsia who it never goes away. And then we realize, oh, they don't just have preeclampsia, they actually have high blood pressure, they have hypertension. Because again, not everyone has their blood pressure checked routinely, and sometimes the only time it happens is when you're pregnant. And so we sort of coincidentally diagnose someone with hypertension during pregnancy, and it sort of presents as preeclampsia. And then if it never goes away, they have hypertension. So that sometimes happens. And also, and I'm sure they told you this, that people who get preeclampsia in pregnancy, for whatever reason that's not well understood, in their lifetime have a higher risk of developing hypertension 10, 20, 30 years from now.
Right.
And so it's something that it's appropriate to be on the lookout for it, and, to have your blood pressure checked periodically and get a physical once a year, or, whatever it is. And the same is true for like gestational diabetes. If you have that in pregnancy, you have a slightly higher risk in your lifetime of getting it. It could be 30 years later. It's crazy, but it appears to be it's mostly just unmasking something about your body and your health, not so much that the preeclampsia like changes your body into somebody who gets hypertension, but more likely it's unmasking some sort of predisposition to it.
Is
That's
the
the current thinking.
5% all preeclampsia, or was that 5%? Do we know what the percent is of women who get it postpartum?
Oh, of that 5%, the majority do not get it postpartum. I'd have to look up the exact number, but I would say probably, if I had to guess, 80 to 90% of those, it's going to present,
Yeah.
probably before they deliver. And, the chance of getting postpartum preeclampsia alone more than 3 days after delivering, I would guess is under 1%.
It's so interesting though, because Dr. Berlin, you see a lot more pregnant people than I do, but just within friend groups, I've had two close friends recently who also had preeclampsia postpartum without really any symptoms and were only checking their blood pressure because of my experience.
I think, and you asked this before, Dr. Berlin, about whether it's actually happening at a higher clip or whether we're just diagnosing it more. And I think it's probably a little bit of both. Some of the risk factors for preeclampsia are increasing amongst childbearing folks, specifically age, BMI, use of fertility treatments, things like that. Again, that's not to scare people. Most people who have whatever age, BMI, or fertility treatments do great. And, God bless, they should have kids. But there are risk factors. And so those risk factors are a little bit more common. But I do think since there's a little bit more awareness, people are more likely to get their blood pressure checked. And because it's so much easier to do it now with home blood pressure cuffs and remote monitoring systems, and there's all these ways to do it with like smart technology that I think more people are checking. How many of them would have been horribly harmed if they didn't check? Hard to know. Sometimes it's very mild and it would have just passed on its own without anyone knowing. And other times it's probably saved lives, but that's probably fortunately rare.
Right, but that all makes a lot of sense to me, given those risk factors and given people are having babies later and having more in vitro and other assisted reproductive technologies and more multiples. But it doesn't explain Jamie's friends because I don't think any of them had those particular factors. But checking and being able to find it earlier also probably, as you said, once the placenta's out, it's going to go away at some point. So if it doesn't cause too much of a ruckus, just high blood pressure and maybe some swelling in the feet, or you probably would not really separate that from things that you naturally feel postpartum anyway.
Correct.
So it could have been some of those more silent cases are on the radar now. Before we go to another break, I have one question that if I was sitting at home listening to this, I would wonder, because you said it's a reaction to the placenta. A popular trend for people to eat the placenta now. If you have these kind of things related to placenta, whether it's gestational diabetes or hyperemesis or preeclampsia, was there a consideration or thought to not eat that placenta?
I got an answer and then I've got a story. So the answer is, when people consume their placentas, typically they are first processed, and the processing of the placenta probably denatures a lot of the proteins that would potentially do this. And secondly, when you take a placenta and you eat it and it gets digested, it's probably a lot different than it being inside your body and secreting things directly into your bloodstream.
Yeah.
So as far as I know, eating the placenta would not increase the risk of preeclampsia. Now, hyperemesis, if you throw up because it's gross, then that's a possibility. People could do whatever they want with that. The data supporting its benefits are limited, and there's potential for risk. I think it's probably not great benefit or great risk. It's just a little bit unusual. I was meeting with a couple and they were talking to me about, we don't have a lot of people in my practice who do this occasionally. So they're talking to me about their plans to take home the placenta and what they're going to do with it, how they're going to eat it and how they're going to prepare it and all these things. And I don't know, I guess I'm not judging them. I don't really care either way, but I guess something about my face gave away that I thought this was a little unusual. So the husband, he said to me, well, Doc, you don't believe in eating your placenta? And so I said, well, it's not a matter of belief. I mean, I believe people do it. Like, that's fine. If you want to do it, go ahead. But, it's not my thing. I'm not into it. So he decided to push forward. He leaned in, sort of like leaned in and gave me a very stern look and said, Doc, don't you know that all mammals eat their placentas? And so I leaned in and I said, not this mammal.
Also, by the way, some of the animals out there eat the baby too, but we don't.
Whatever. Again, I'm not judging anyone. God bless. If that makes people feel like they're doing better or whatever it is, go for it. It's just
I think it's only a matter of time before we have impossible placenta anyway. And then, anyway, let's take a little break. When we come back, we'll find out more about Jamie's second pregnancy and if there's anything you can do to try to mitigate your risk of preeclampsia. We'll be right back. Welcome back. We're with Jamie Barstein and Dr. Nathan Fox talking about preeclampsia, and in this case, in particular, postpartum preeclampsia. So, Jamie, you got pregnant again. Is there a concern that once you've had preeclampsia, you might get it again?
Yeah, I think, is it 50%? Is that right?
It depends. It's probably somewhere between 25 and 50% based on the circumstances.
Well, in my head, it was flip a coin. I might get it, I might not.
Yours is pretty severe. So the more severe it is, the more likely it is to happen again the next time around. So I would have said probably somewhere 25 to 50%. But we would have operated under the assumption that it's a strong possibility. And we would have been, all hands on deck for your next pregnancy.
Well, it's interesting when you said you were pretty sick. I have to say that really validated my experience because I felt really sick and I felt sick for a long time postpartum. I mean, who knows what a normal experience is? Of course, postpartum is an experience regardless, but I do feel like it took a while from my physical health to feel like, like I could even go for a walk without being out of breath. Again, how much of that is just normal postpartum experience? How much of that is preeclampsia? And I knew I wanted to have a second child, but it was definitely something that, I'm already run pretty medically anxious. And this was definitely a factor in terms of, I know I want to do this, but I want to be really thoughtful and mindful. So yes, pregnant again and taking baby aspirin every day. So that's to decrease my chances of having preeclampsia, right?
Yes.
How does that work?
No one really knows. I mean, you could fill a semi with the things we don't know about this, but there's thoughts about, how it alters various angiogenic factors in the placenta and in your blood vessels and how your response is. But ultimately, aspirin has been studied extensively in terms of reducing the risk of preeclampsia. And the studies are pretty consistent in aggregate when you look at very large numbers that people who take a low dose of aspirin in pregnancy have a slightly lower risk of getting preeclampsia. It reduces it maybe like 10 to 20%. And that's a relative reduction, meaning so if your risk was 10%, it'll lower it to 8%. It doesn't lower it from 10 to 0. The questions are how much aspirin, like do you take 81 milligrams, which is baby aspirin in the US? Do you take 162 milligrams, which are 2 baby aspirins? Just for comparison, 1 full aspirin is 325. So a baby aspirin is 1/4 of an aspirin, and 2 baby aspirins would be 1/2 of an aspirin. In Europe, they sell 100 milligrams, they sell 150 milligrams, and people have tried all those different ones. But it's pretty much universally recommended if you've had a history of preeclampsia in the next pregnancy to take some form of low-dose aspirin. Interestingly, in my practice, we recommend it to everybody across the board. Like literally, I would stick it in a prenatal if I could, because there doesn't appear to be any downside. And the only reason it's not recommended universally is because most people walk around with a low risk. And so lowering it from 5% to, let's say, 4% or 3.5%, it may not be worth it to recommend to millions and millions and millions of people to take baby aspirin. But in our practice, we do recommend it to everybody.
Are there other things?
Other things that will lower the risk?
Yeah.
There's some evidence that taking calcium supplements will lower the risk. That's predominantly studied in people who have very low calcium intake. And so in the past, when these studies were first done, like 20, 30 years ago, they were looking at like other countries with poor nutrition. And they said, if we give them calcium, it lowers the risk. And people sort of poo-pooed it in the US. They're like, we're not a developing country. Like we have great nutrition, we eat, but no one I take care of drinks milk or has dairy, right? Dairy is like poison now for everyone. So no one gets the recommended calcium, which is 1,000 milligrams a day. That's for non-pregnant people. So when you're pregnant, 1,000 a day. So I always ask them, like, how much dairy do you eat in a given day? Someone's like, oh, I might have a yogurt and maybe I put some milk in my coffee. I'm like, all right, that's 400. That's it. So
okay,
I tell,
but in LA, it's a soy yogurt anyway.
Yeah, so I tell pretty much everyone.
I was going to say 0 dairy. In fact, the first trimester I had dairy. I threw up so much that my doctor was, let's cut out dairy.
Yes, so I tell people that they should get 1,000 a day of calcium from all sources, wherever, dietary supplements, whatever it is. One of the nice things about calcium is you can buy it as gummies, which are delicious. They can't put 1,000 milligrams of calcium in a prenatal because the prenatal would be so big, you'd have to cut it with a fork and a knife. So the typical prenatal only has like 100 or 200 maybe. So other than those, if you have chronic hypertension, taking blood pressure medicine seems to lower your risk of getting preeclampsia. Having a healthy lifestyle, like some sort of regular exercise that gets your heart rate up tends to be helpful. There's some evidence of certain diets that might help, but probably not that much. And then most of it is just monitoring. I tell people who have a history of preeclampsia when you're pregnant to start taking your blood pressure at home once a day in the third trimester, to be on the lookout for things like swelling. Even if you think it's normal, just make sure to check your blood pressure. If you're checking it every day, then you wouldn't have to worry about your swelling. Signs like, again, headaches and unusual symptoms. And that continues even after you go home after delivery. Even if someone's preeclampsia was not like your story and they just had it in their first pregnancy in the more quote unquote typical way, I would still tell them the next time around, even after you go home, check it every day for at least 2 weeks.
Yeah, that's exactly what I was doing. Yeah, checking my blood pressure. I checked my blood pressure pretty much daily all of pregnancy because I was also medical anxiety, and had a great doctor who said, like, great, check your blood pressure. If you're feeling off, check your blood pressure. If anything, that's going to help your anxiety, right? Like to know, like, okay, it might just be pregnancy that I'm feeling off because pregnancy is strange. And also good, like you are at risk, check your blood pressure. Yeah. So hearing you say stuff, a part of me is like, oh man, I should have taken calcium. That would have been the one thing I was missing. Yeah. Like I did the exercising and the eating healthy, right? But that's, perfectionism. But yeah, so, was really thoughtful, really mindful, monitoring myself. We're at the hospital and I ended up with a planned C-section this time. Every time the blood pressure thing goes off, we're like breathing a sigh of relief. And then came home, was monitoring my blood pressure, and unfortunately it was high. It was not nearly like it was after my daughter. So it was, I think, 165 over maybe 110 again. I can't remember. So unfortunately went back to the hospital. And I'll say that again was like such an emotional experience for me. And it was interesting. It was less about leaving. So my second is a boy, and it was less about leaving him. I was really mindful of preparing my toddler for the time I'd be away from her. And I kept thinking, like, she's going to wake up in the morning and say, where's mommy? Kids are so much more resilient than we often think. I think that was a projection of my own anxiety. And as a child psychologist, knew rationally, but was just so emotional. Like, I can't believe I'm here again. I can't believe I'm doing this again. I mean, it turned out I had a much milder form and was there for 24 hours this time, and then took medication at home. But it was still, I mean, it was a pretty emotional process of like, I think there was a little bit of kind of trauma response for me of like, I'm back here, I'm doing this again. I can't believe it. I did the things I was supposed to do. I took my aspirin and I ate healthy and I exercised and have a healthy lifestyle. But the reality is it can affect anyone.
Yeah. I mean, it probably had a more mild course because you caught it earlier.
Yeah, for sure. Yeah.
Meaning the reason the blood pressure is lower, if you waited 2, 3, 4 more days, it probably would have been much higher and it probably would have been worse. Yeah.
Yeah. I was like, please don't give me magnesium. I remember I came out there like, so we have good and bad news. The good news is that, you're normal in these areas, but the bad news is, this is preeclampsia and we do need to start you on magnesium. Not a fun drug. Yeah.
Is there anything you can tell, like if you're trying to monitor yourself and you check your blood pressure and it's a little high, is there anything you can tell from a urine dipstick at home? Or
it's blood work, right?
If you have urine dipsticks at home and you can check for protein, that's fine. But if your blood pressure is high, you should be bumping it up to a professional at that point anyways.
Really? Not just ChatGPT?
Yeah. No, I mean, ChatGPT is a professional. But yeah, if you have protein in your urine, but your blood pressure is normal, usually you're going to stay at home. But if your blood pressure is high, whether you have protein in your urine or not, you should be seen.
Doesn't matter. Got it.
Yeah.
Well,
James, are we doing it again?
That's what I was just going to ask.
I got it. That's
Number 3, come to New York. Me and your sister-in-law will take care of you.
Yeah, right. I know. I have a great therapist, a lot of processing with my therapist on whether I could do it again. Yeah. I will share that was part of the emotional experience I was having being rehospitalized. And, I was thinking like, yes, I'm really emotional right now. Lots happening. Was like, oh my God, am I going to be able to do this again? And sometimes I have some thoughts around like, maybe this time it'll be the worst, but I appreciate what you're saying too, is like, maybe it was milder because I caught it. And with both times was under good care. I think the first time was really just the shock of it all. I mean, not to say you can ever predict how anything's going to go when it comes to pregnancy or delivery or postpartum, but I think it's helpful to know that it's so rare, but I do feel like that knowledge around it is so important because if I asked 90 99% of my friends, they're like, I didn't even know this could happen postpartum.
I mean, you're a psychologist. You don't need me to tell you this, but a lot of the times when it gets really tough for people is when it's not necessarily the fact that it happened, right? Because people sometimes have very challenging parts. It's sort of the experience when you go through, and if your experience doesn't match your expectations, that shock is much worse. And so the second time around, it's a bummer, obviously, that you got it again, but
Yeah.
your expectations were that this could happen, it might happen, you're watching for it. And so when it happened, you're disappointed, but you typically wouldn't have the same level of like trauma that you would when it comes out of left field. And so
Yeah.
the hard part about that is, okay, so does that mean I should scare everybody who's pregnant? Oh, this could happen to you. And it's sort of like, all right, so for the person who it happens to, great, their expectations were matched. But then for everyone else, I'm just scaring the hell out of them. And so it's a tough balance for, how do you educate people and have them understand these things and know these things in a way that doesn't scare the hell out of them.
Right. That
So
instead you're your
yeah,
own advocate.
yeah, it's
Yeah.
tough. It's like meta medicine. How do you do these things in a way that keeps people as delighted as possible through the course of their pregnancy, but also keeping them really informed and keeping them, educated and so they can advocate. And it's a very tough balance. Yeah.
As we wind down this episode, we've shared a personal story of not once but twice postpartum preeclampsia. Thankfully, treated well, but still a very, very physically and emotionally challenging condition. And we've given some information about the percentages and likelihood that it would happen both before and after birth, some of the signs and symptoms to look out for and be aware of, and even a little prevention potentially. On top of that, as a final note to somebody listening who's pregnant or considering a pregnancy, what would you guys recommend, Jamie, having lived through it, and also Dr. Fox, this difficult balance that you're mentioning of sort of wanting to be on the lookout but not wanting to be terrified?
Stay away from WebMD. Yeah, lean on your medical sources, right? Like trust your gut. If something feels off or wrong, trust your gut. I think a lot to that on-call doctor who, may have been exhausted and I don't know, said, why are you checking your blood pressure? It's like, something doesn't feel right. That's why I'm checking it. So trust your gut and also, and advocate for yourself, and then also be mindful of when your anxiety is taking over and I always call it spiraling into a path of now this is making me feel worse versus I'm going to seek information. I'm going to seek care in order to make sure I'm okay.
Yeah, I agree with that 100%. I would also say, and this is a plug for you, Dr. Berlin, and I guess for me as well, I think everyone, again, whether you're pregnant, whether you're thinking of getting pregnant, you have to find the sources of information that work for you, that are reliable, that are understandable, and that speak to you. And for everyone that's different, obviously, I would say this podcast right here is a very good one. And I think mine is a good one. There's others that are good, obviously, whether it's that, whether it's a book, like you mentioned. Emily has written great books, whether it's her books, whether it's another book. There are good websites. You just have to find what they are and that they're, again, reliable and they speak to you in a way that some people want more medical ease and other people want more colloquial. And you have to see which one it is and then try to educate yourself as much as possible in a way that's not terrifying. So you sort of know what the possibilities are and what could happen. And I would rely on those much more so than just Googling and finding, the worst option out there and saying, all right, I'm going to die.
I trust everything you say, especially this being a great podcast. I take that to heart. Okay. Well, I want to thank you both for being here, and Jamie sharing your personal story and Dr. Fox sharing your professional expertise. Very potent episode with a lot of valuable information that I know will be helpful to a lot of people. Doc, you've been on our podcast before. For example, we talked about anemia and low platelet levels in episode 228. External cephalic version is actually a very popular episode, episode 299, and thrombophilia in episode 325. There are others.
299, that was the big one.
299 was, yeah, we almost made it to, but there's more of you to go around aside from people living in New York who can come see you and you can be their doctor. Where else can we find you, your podcast and other resources?
So you can find me prowling about either the Upper East Side of Manhattan or Englewood, New Jersey. I'm the middle-aged guy with all the Cubs paraphernalia in the wrong town. So you'll find me there. Yeah, I mean, the podcast is probably the best way. As you said, it's called healthfulwoman.com. It's a horribly named podcast because it's impossible to pronounce, but it's like the word helpful, but health. And
Healthful.
and we're everywhere you find podcasts. We have a website, healthfulwoman.com. And again, as you said, that I was privileged to co-author a book with Professor Emily Oster, who is the best of the best. And that was a really cool experience. We have a whole chapter on people with a history of preeclampsia and other things that have happened in people's first pregnancies.
Well, I'm glad you're keeping busy.
Doing my best, man. Doing my best.
Thank you guys again. And at home, thanks for listening to our podcast. For more pregnancy and parenting information just like this, visit us online at informedpregnancy.com.